Good afternoon. Good after. Good afternoon. If anyone has a comment for the 24 amended budget, please sign up. We have a sign-up sheet. If you have anything you'd like to speak to for the 24 budget, please sign up on the sign-up sheet. Thank you. Good afternoon. Welcome to the House Appropriations Subcommittee on Health. We will open our meeting. Chairman Hawkins, if you would give us a blessing.
Please bow your heads. Oh, Father, we come before you today with humble hearts, asking for your wisdom and help in the decisions we make for this state and its population. In your name we pray. Amen.
Thank you. And our first, I have a speaker. If you can wait 1 minute, I have another one that's coming up. Representative Stoner, you have a presentation to make.
Thank you, Madam Chair.
Thank you.
I'll try not to touch the computer if I can.
You can do the slides.
Yeah, want to do the slides for you, Russ? Well, thank you, Madam Chair, and I appreciate you letting me come up to speak first. For those on the committee, and I think you have a document in your folder, which has to do specifically with an issue I've been working on even prior to me coming back here to the General Assembly, and that is the South Cobb Public Health Center. This is a new public health center that the county, several partners, local partners, have been working on really for the last about 7 years. And I'm not going to go through this whole PowerPoint presentation here. There's a lot of data here. The thing I think that's going to be important to this committee is exactly who the partners are and exactly what services we're going to be offering, because these are some services that we as a legislature have been focusing on here in the last several years that this new center is going to definitely focus on. So that's something, if you want to take a look, and that's back a little farther back in the presentation about proposed services for the new South Cobb Public Health Center. And you'll be sound real familiar to y'all on some issues that we've been trying to deal with here down at the General Assembly. And we're going to be expanding Healthy Start pre and postnatal services, expanded WIC, babies born healthy, assuring prenatal medical care, breastfeeding education equipment, babies can't wait, vaccinations, health education. I mean, this goes down the whole list. This is a 30,000 square foot facility that we're putting in South Cobb. And one thing in particular it's going to have is mental health services. And this is somewhat unique in a lot of our public health facilities, that we're going to have dedicated mental health services. And if you look over to the proposed facility itself on this document, we're building, for the public health piece alone, a 10 to 12,000 square foot piece of this 30,000, and the mental health is going to have a 4,000 square foot piece. So it's a dedicated space. This is not, mental health in some little office somewhere. This is a serious investment. We're also are going to have somewhere about 8 to 10,000 for a federally qualified primary care provider, third-party provider, as you're well aware of. So this is a truly comprehensive approach to these issues in our South Cobb community. And just to understand, this is something, when I was the chairman of the South Cobb Redevelopment Authority, which dealt in this area, we had property, and we decided to contribute that property for the purposes of building this facility so that the dollars that we put together go to actually the facility. And if you look at that in the sense of whose partners, we have Cobb County, obviously the Cobb-Douglas Public Health, because Cobb and Douglas work together, facility, and so Cobb-Douglas Health put in $4.5 million. The county has put in $2 million in SPLOST and $7 million in ARPA money that they had, so that's $9 million. And we sat down with them very carefully and figured out that this facility was going to cost $16.5. So we have about $13.5 million. And so the reason for my appearance here today is to request an additional, to kind of fill that budget hole, $3 million, because once we do that, we can start construction on this right away, because we have the land, we have the programs, and we have the operating funds to run these programs. So this is just a one-time ask, and it will have a huge impact on this part, and not just South Cobb, but if you remember, I said Cobb-Douglas Public Health. So if you know where Six Flags is, this is the area we're talking about. And we're right there on the Cobb-Douglas line. So even though a lot of citizens of Cobb, we have the ability also to serve folks over in the Douglas County part too, right there. So again, the way to look at this is a joint effort on everybody's part in our local community. It's two counties working together, and it's different agencies working together to address these issues that we talk about here regularly down at the General Assembly. And so that's why I'm here today, is to ask for support in the amended FY24 budget to make this happen, and make it happen soon.
Thank you very much for your presentation. We appreciate it.
Thank you all very much. Appreciate your time.
Thank you. Okay, thank you very much. Our next speaker will be the Commissioner Russell Carlton with our Department of Community Health, and I appreciate your patience. Thank you.
Of course. Thank you, Madam Chair, members of committee and staff. Thank you for allowing us to be here today. Try to angle everything appropriately. So I normally work from my binder, so as long as Scott doesn't mess with my notes, I might kind of refer in case I'm reaching behind me every now and then. But I do want to thank you for the opportunity to be here today to discuss the governor's amended FY 2024 budget recommendations. I did present to the Joint Appropriations Committee, so I'm obviously not wanting to be duplicative, but I do feel it might be helpful to start out my comments today in a similar fashion to how I started my comments last week, and just take a few moments to paint a little context to the environment and healthcare, Medicaid and beyond, where we find ourselves, and obviously this manifests itself throughout all of our budget projections and policy contemplations, as so much is converging at once, to say the least. As many of you are aware, the federal Consolidated Appropriations Act of 2023 set several things into motion, and I've listed them here, again, knowing that some of these documents are also a takeaway from you, but I can go into as much detail as you like. But the Consolidated Appropriations Act that was passed this spring declared May 11th the end of the public health emergency. Again, that was a federal act. Congress and the administration set many things into motion. It simultaneously mandated that we redetermine all 2.8 Medicaid members in Georgia, and that applies to all 56 states and territories. So everyone, per the federal government, was mandated to go through this exercise at the same time. Because as you know, during the PHE, the public health emergency, no one's Medicaid status was revisited, redetermined. So if you were on, you stayed on to the end of the public health emergency and until we get to your case in the redeterminations process. But so basically what that meant for Georgia is over that 3-year period, the Medicaid rolls went from approximately 1.8, 1.9 million members to about 2.8 million members. And then we were asked to reconsider, revalidate all of the eligibility for those. Now, while the federal government gave us 14 months to go through that exercise, in Georgia, unlike some other states, we elected to take all 14 months of that to work these cases diligently and to be efficient yet be thoughtful at the same time. So we have 14 months to go through this exercise, yet, as you'd imagine, the federal government started turning down the enhanced FMAP pretty much immediately, and it began a phase out. So during the public health emergency, our FMAP had basically gone from 66% to about 72% at its peak during the public health emergency. So they began to phase that out quickly, more than 14 months. So the exercise takes longer than the enhanced funding, and that's something we're always mindful of. So that began in the spring. We are roughly we're a little bit past halfway in that exercise. It will end May the 30th, but there's also a bit of a lag as we allow for due process, if you will, for appeals. People do have 90 days after their date to get paperwork in. They can request reconsideration. They can appeal through OSA. So while Medicaid redetermination technically ends on May 30th, the exercise will extend well into the fall, if not beyond, as you would imagine, because if someone's redetermination date is at the end of May, their 90 days to get some of the paperwork in and go through the process, that alone would extend it out into August without taking into account, as you'd imagine, backlogs and people going through the appeals process, a different status of different levels of pending status. So that dynamic, as you would imagine, there's several things converging there. One is a fluctuation in enrollment, people coming off, yet new applications are still coming in. So people are coming in, people are coming off, people are appealing, so in and out. So enrollment is going down, it's fluctuating, but the end result is it's going down while healthcare costs, inflation, and it's not about utilization is on the rise, specifically within mental and behavioral services. So utilization's going up, the cost of doing business is going up, but our enrollment is fluctuating, knowing that at the end of the public health emergency, the intent per the federal government was to true up the roll, so enrollment will steadily decrease over time. So if I can, beginning on slide 4, we kind of get into our budget presentation proper. I believe this is a slide that you have seen before, where it kind of speaks to our state funding per program. And as always, the aged, blind, and disabled population, ABD, and the low-income Medicaid make the bulk of our expenses. And here you have the state funds represented at $4.6 billion. And here are our total funds, $19.6 billion. And again, a similar breakdown between ABD and low-income Medicaid, but also accounted for in these slides, the state health benefit plan and those claims. I always like to use this slide as a reminder. between 97 and 98% of our budget goes to benefits. And so while it's a large number, it is intent to pay out to members. Okay. Just a few highlights as we begin to kind of transition to your tracking sheet. These were items per the budget. Obviously, something that's been important to this body for some time is we were proud to execute on the legislative initiative to increase reimbursement rates for developmental and behavioral screening and testing, which does include autism screening and several policies of great import to both chambers. Now we work through the recommendations themselves. Here's a summary of various different programs and divisions. I would point out that the reduction in healthcare access and improvement is a transition funds to cover peach care claims, peach care for kids, to true up some expenses there. And then the reduction, again, in low-income Medicaid, the reduction there, while ABD remains static given the population and the dynamics at play there, the low-income Medicaid population saw a reduction due largely to enrollment, as we talked about the push and pull of the redetermination effort. Now, again, trying to stay in sync with your tracking sheet here. And I'm trying to stay in sync with my own notes. And I do want to make sure I point out a great deal of appreciation to the governor and OPB, and want to thank all of you as you contemplate and deliberate upon the budget. The $1,000 salary supplement for our entire department in December was greatly appreciated. Something that I always think is important to point out, like many agencies are going through, for all the things we're tackling and trying to navigate our way through these unique times in healthcare, it should be noted that the challenge, and something that Joe Hood, our state COO, and our entire team are always working through, is 1/3 of our agency is retirement eligible within the next 2 to 5 years. And specifically within Medicaid, that division itself, that percentage is closer to about 45% retirement eligible in the next 2 to 5 years. So obviously there's a lot of time thinking through that with our recruitment strategies. And so when you assist us, whether it be these stipends, the COLAs, other things have been contemplated, and when you keep in mind the state health benefit plan, which I know benefits all of us, these are big things to our workforce in some challenging times, so they don't go unnoticed and unappreciated. Speaking of the salary supplement, that also applies to HFRD, which is our regulatory division, our surveyors. And then we begin working through the line items themselves. And obviously, I would point to several of the programs. Again, age blind disabled, you don't see as much fluctuation in enrollment given the population and their status. But one thing I would point out that is not always done in the amended budget, I like 17.7.3. Nursing homes being rebased to their 2021 cost reports. The reason that's fully funded here is that was a yes item in last spring's Appropriation Act. So we're funding it here in the amended, and so it's basically funding the policy that was enacted this spring, last session. And then again, as we go to LIM, low-income Medicaid, you'll see the reduction to account to the fluctuations in enrollment. And then the transfer of funds from healthcare access, one of the $4 million of that went to, were one-time funds from last year that went to, that's the peach care line item, I apologize. There's a similar line item for $4 million that went to your GMA programs and the Rural Healthcare Stabilization Grant, so I apologize there. But that is growth in peach care for kids in the Medicaid program. I apologize, 17.9.1. as we go through the benefits packages themselves, again, kind of similar, just presenting in a different way, kind of a comparison with programs, the same totals you should have seen in the previous slide, just lined side by side for whichever means of consumption is best for you, but again, pointing out to the different programs, ABD, low-income Medicaid, Peach Care for Kids, and the total funds. At the bottom right, the total state funds for the amended budget is over $125 million. I want to also take this moment, as you see before you, Brandy Sylvan and Caitlin Ward, who do so much for us during session, but year-round, or hopefully, I know they've probably, chances are, worked with some of you on your constituent matters and SHPP and beyond. We're very grateful for their service to you year-round. So, Madam Chair, that walks through the programs themselves, and I'll be obviously available for any questions of the committee.
Thank you. Thank you very much for your presentation. We do have a question. Representative Hughley?
Thank you, Madam Chairman. Thank you for the presentation.
Yes,
I
ma'am.
just wanted to know on this redeterminations, where are we now, and what was the primary reason for people not filling out the form, or whether did they go to the wrong address, or what was happening?
Yes, ma'am. No, that's a good question, and we knew all along this would be a challenging exercise on all fronts, and that's why we tried to not only have the best data we could have to tell us the status and to help navigate, but hopefully we're working our way towards more actionable data where we can tell where hot spots are throughout the state and try to increase our outreach there. I think to your direct question, it's a little bit all of the above. We spent roughly a year prior to the public health, the declaration of the public health emergency ending. About a year prior to the redetermination effort, we tried to work with our CMO partners, various other stakeholders, provider groups, to first and foremost update everyone's information. We had partners that DHS worked with and we were a part of to hopefully start a Stay Covered PR campaign to try and raise awareness to first get the most updated information we could. And then as the exercise started, we began a program that started 45 days out. We began notifying an individual of their redetermination date forthcoming. And we first of all send that out and ask them to begin processing that now. And we run the ex parte process at that point that hopefully can determine if there's enough information provided to determine up front if they qualify or don't qualify, or eligible or not eligible. We send a second notice prior to their redetermination date. Again, 45-day first date. There's a second notice that goes out. And then when the redetermination date hits, say it's July 1st, you still have 90 days to get your paperwork in to be considered. So we've tried multiple touch points, and again, using that actionable data where we can. For example, just recently, and I think we have an event coming together next month in Gwinnett County. That's a redetermination exercise. It's an event. DFACS, I want to thank Commissioner Brose for making caseworkers available to go to that event. We saw Gwinnett had work, so we're going out into the community with caseworkers trying to raise awareness. I know Mr. Thurman and DeKalb and some of our CMO partners hosted one event there this fall, and I believe have a second event on the books. So where the data leads us in a particular direction, we're trying to do a good job of acting on it. Yes, ma'am.
Thank you. I don't see any other questions. We appreciate your presentation.
Okay.
Thank you.
Thank you, members of the committee.
Our next speaker will be the Georgia Board of Healthcare Workforce, Director Bassin. Thank you.
loaded? Yeah. All right. I'll get started while the file gets loaded. Good afternoon. I'm Chet Basine, the Georgia Board of Healthcare Workforce Executive Director. I want to say thank you again for having me and allowing me the opportunity to present the governor's amended FY24 budget, which will be brought up here in a moment. In the meantime, I was going to take a couple minutes just to give an update on the agency, just so everyone knows that we are we're administratively attached, thank you, to DCH. Our agency is primarily responsible for administering funds to medical schools, hospitals, nursing schools, administering a variety of loan repayment programs, GME, graduate medical education endeavors, and data analysis for the healthcare workforce here in the state of Georgia. So high level, if that assists, that is who we are and what we do. I have 6 quick slides, or by program, and then a summary slide. So if there's a mathematician out there, I do have more than 6, I have 7. But each will list the programs, and I'm going to start here with the administration program. You will see high level, again, we've got the cost of living adjustment, which I echo what Commissioner Carlson just said moments ago. It is highly appreciated from staff. It allows us to retain and attract and excellent talent. So for that, it is definitely noticed and appreciated. And then we have the $180,000 for additional staff and technology. So that is the administration budget. If there's any questions, then I'm sorry, this is the FY24. This is not the AFY.
That's what you said.
You sure? This is not the right budget.
I was going to say, it does.
Can I reference with tracking sheets because I have the right document?
Yes,
Can we
please
that?
do. Please do.
Okay. So I'm going to start back up. If you go to your tracking sheets, and I'll use the document, the numbers, you'll see 17.11 is board administration. What you will see is back to the one-time salary adjustments. Again, those are appreciated. It allows us to retain good quality staff and keep good talent. So that was 17.11.1. There was in 17.11.3 a reduction just to align budget to expenses for operations, which yields a net of $6,450 program net reduction for the administration budget. Are there any questions on that one? No, okay. The next few are really no changes. So the next one is our GME program. That is 17.12. There was no change. So unless there's any questions on the GME program, I will transition over to our next program, which is section 17.13. It's the Mercer Medical School operating grant. Again, there was no change there. The next section is...
We do have a question. Let's see. Representative Seawall?
Yes. Thanks. On the increase in funds for 102 new residency slots, how many are those? Are those being funded in like rural Georgia, or are they all over the state?
The residency slots, when they are funded, they are at the programs that are starting up GME just because there's a multi-year pathway. So what we do is annually around the fall time, we ask all the different hospitals that we're aware of that have GME, and there's always one that seems to show up that we weren't aware of. But vast majority, they tell us, hey, this year we're going to be adding this many slots in this specialty. Next year we're going to be adding this many. So it really just depends on who is planning to do what, whether it's new GME or expansion of their GME.
Thank you.
Sure. In section 17.14, the Morehouse School of Medicine operating grant, again, no change in that. Section 17.15.1, there will be a reduction of $850,000. That was monies for a behavioral health service cancelable loan program. There was no authorizing legislation, so the funds are being removed. In section 17.16, undergraduate medical education, again, no change. And then that is our 6 programs. The only 2, again, had changes were administration and the service cancelable loans that I just mentioned a moment ago. Were there any questions that I could answer?
You do have a question?
Yeah, for the dental, I guess the dental rural loan repayment program, that's included in the physicians?
Yes,
Is
that's
that correct?
just the program name.
Right.
But yes, the dentist, you're
Right.
correct.
Right, thank you.
Chairman Parrish, you have a question?
Yes, ma'am. Yeah, with a lot of the new responsibilities you have, and by that I mean more people you have to process, do you have the staff and the technology and the equipment that you need to properly turn around protocol agreements and this and that and the other in a timely fashion?
Thank you for that question. I do believe we are in a position now, over the past 12 months was a period where we had some vacancies with staff. We have filled almost every role. We do have 1 vacancy, but we do have interviews this coming Monday, and the candidates are very promising, so I believe that vacancy will be filled. One other thing, just there's a series I could offer you in details, but I'll just give you one good example. We historically, up until April of 2023, executed agreements through standard mail and paper. We actually have started to use DocuSign. That not only allows us to move a little quicker, it's a lot more efficient, it's trackable, and it requires less human capital.
So I think you're answering my question that you've got what you need, right?
I believe so at the moment, yes.
Okay, thank you.
I do have a quick question, and it goes to this same subject, and that was 17.11.2, and that was your additional staff and technology. Is some of this technology to assist in the processing of the loans? It's going to make it more efficient?
Yes.
Okay, thank you. I don't see any other questions. Thank you very much for your presentation.
Thank you for your time.
Our next presenter will be the Georgia Composite Medical Board, the Director, Daniel Dorsey.
Well, good afternoon. My name is Daniel Dorsey. I'm the Executive Director of the Georgia Composite Medical Board. I'm here today to present the amended fiscal year 24 budget recommendations to you guys.
Could you pull your mic a little closer? Thank you.
Is that better?
That's better. Thank you.
Just a little bit about us. The mission of our board is to protect the health of Georgians through proper licensing of physicians and certain members of the healing arts, and through objective enforcement of the state's Medical Practice Act. And just a little bit about our board. We've got 16 members appointed by the governor, and about 35 staff members. That includes 7 post-certified individuals. Our licensee count, somewhere around 62,000 as of about a week ago, and that most of that is physicians, but we do have a lot of other allied health professions that we license. During FY23, we processed over 7,000 initial applications and renewed over 26,000 licenses. And we've got a little graph there to show you what our initial application volume has been over the past couple of years. From an enforcement perspective, FY23, a little over 1,900 complaints. So our revenue, our appropriated budget in FY23 was 2.6 mil. That all went to salary and fringe of our roughly 35 staff members. During FY23, that same year, we collected around $7.5 million in licensing, renewal fees, and enforcement fines, which was turned over to the state's treasury. The board keeps all of its administrative fees to go towards operating expenses. No state funds go towards our operations. As far as the governor's recommendations, got 17.7.1. The first item is to increase funds to provide for one-time $1,000 salary supplement for full-time benefit-eligible employees for recruitment and retention. And just want to echo some of the comments from our previous presenters that this was a very welcome announcement to my employees. When this was announced, I remember there were some tears out of my employees because this was around Christmas time, and they were able to then buy some of the gifts that they wanted for some of their kids. So this extra money really did go a long way in making Christmas for some people. 17.17.2, utilizing existing funds to upgrade license application software and to fully digitize our application process. This was a yes item to utilize the funds from our retained source. And then 17.17.3, which was to utilize existing funds to upgrade technology and equipment. Again, this was utilizing our retained funds. The program net would only be an additional $27,989 that would be added into the amended fiscal. Just got a recap of 2022, 2023, some of the things that we've done to, we've tried to work in a more paperless direction, trying to utilize technology more as we move forward. And so I've got some items there, some things that we've accomplished, and then some outlook for this upcoming year. Just trying to, again, move in that more paperless direction and just really fully utilize the technology that we have access to. And contact information. If I can assist with any issues that your constituents may have, please reach out. We want to make sure we're accessible and resolve whatever issues there are in a quick fashion. And if there's any questions, happy to
Yes, you do. Chairman, you have a question? Oh, number 7. I'm sorry.
I've got one.
Go ahead,
Okay.
Chairman Parrish.
I want to ask you the same question I asked earlier. Do you have the people and the equipment that you need to run the department in a timely and efficient manner now to do the job you want to do? Do you have all that you need to do that, is my question.
Yes, sir. We are grateful for all the funding that we get, and are trying to, like I said, utilize as much of the technology to try to be as efficient as possible. And if y'all see fit to give us additional money, we'll make sure that it gets put in a responsible use to serve the citizens.
Well, what I'd like to do is make sure you've got what you need to do your job in a timely fashion, because we can't expect you to do the job if you don't have the resources to get it done. And this is important with the licensing. A lot of people are just sitting around waiting to get their license renewed or getting that license, process done, and they're not able to see patients and generate revenue for their job and this sort of thing. So if there's some areas that we need to look at, I sure wish we could do that.
Yes, sir. I'll look forward to working with you.
Representative Buckner?
Along those same lines, I was curious, do you do any kind of record keeping about how long the process for getting renewals of the license or the issuance of the license takes?
So renewals are pretty much instantaneous. It is possible that the way someone answers a question on the renewal application, it could put a pause on the processing of the renewal. For example, if someone says that they're not a U.S. citizen, we need to collect certain documentation that we have to run through the Department of Homeland Security, and so we won't process the renewal until we've done that stop. There are some other things as well, but for the most part, probably around 95% of our renewals get processed within about 30 minutes of it being submitted, assuming that there are no red flags. As far as initial licenses, it really varies on the profession. We're most known for physician licensing, and our processing time right now is somewhere around 3 months or so for processing from when we receive it to when the license gets issued. Some things that can hold up the processing of a license is if we don't have all the pieces, we can't make a decision on it. One of the things that we did in August was when someone submitted an application, historically it was they answered the questions and paid the fee, but there was still a lot of supporting documentation that we had to collect, and historically that was sent to us in the mail or via email, but we've now required it as part of the application process on our online portal for those documents to be uploaded at the time of application, which is now starting to cut down on that processing time frame, because we want to make sure we have all the documents that we need, resume, the citizenship affidavit, whatever document, malpractice questionnaire. We're trying to collect those on the front end, so we're not having to play that on the back end, trying to play that game of back and forth of we need this or we need that, that sort of thing. Additionally, we are rolling out a 2-week touch point to all pending applicants. We're going to be getting it rolled out for physicians first, and it's an email that comes from our licensing software that will ping them like, hey, you're missing X, Y, and Z requirements from the checklist. So please get these items to us, and it's going to go out every 2 weeks to applicants. So hopefully that will help cut down on licenses or the process that it takes to get something licensed. So,
Thank you.
I have a couple questions. I know that we've all received inquiries about license renewals. What are some specific ways that we can help you? Is it technology? You indicated you don't think you need more staff. What is it that would help? Do you need to stagger dates of renewal? Again, I'm just looking for what would be the best way to help.
So our licenses are up for renewal on a pretty continual basis. It's based upon the licensee's birth month, and it's every 2 years. So every month we have somewhere around 2,000 or so that we're processing renewals for. One thing that from a technology piece is we do run into issues from time to time with the emails that come out of our licensing software sometimes get routed to spam or junk folders, that sort of thing. Additionally, there's a level of encryption that's there that could then that if someone doesn't see it within 30 days, it deletes that email out of their inbox just because of the encryption that's there. So that creates a really tough challenge for us in trying to connect with people, because we will send stuff out and then we don't hear anything, and after 30 days, it looks like we haven't even reached out. So it's certainly difficult with that. This email
That's
issues.
one of the things we're looking for to help. And I noticed there is an increase in your number of licenses that you're processing. I'm hoping a lot of them are new doctors because we need new providers. So I'm hopeful that's part of what this increase is. Do you have any other explanation for the increase?
So I haven't looked at the data to see if it is doctors or not, but if I had to guess, 2/3 of our total licensee count is physicians. So I would imagine the increase is probably at least 2/3 of that is physicians as well. What's leading to that could be several things. It could be our participation in the Interstate Medical Licensure Compact. Georgia does participate in that, and we are about the 6th busiest jurisdiction in that compact. So we do get a lot of initial applicants that are trying to get a Georgia license through that. It could be that the investment that the state of Georgia has had in their medical education and graduate medical education over the past several years. There's been a lot of investment in more GME slots, that sort of thing, and so that could be creating the demand as well. And it also, Georgia has really positioned itself from an economic development standpoint, making it a really wonderful state to live, work, and play. And more people could be coming here, so that could be some of that organic growth as well.
Thank you. Would it, do you track it by if it's an initial or a renewal so we can see numbers that way? I don't know if you track it that way.
Are you talking about the initial license count?
Yeah, is it the initial filing or is it a renewal? Do you track it?
That's all initial and reinstatement. So because we have some people that have had a license in the past, let it lapse, and now they're trying to get a license back
Okay,
again.
what about if it's somebody just renewing it because it's been 2 years? Do you track them separately as this is an initial filing and this is the renewals?
Yes, we do.
Okay.
And it's 26,000 some odd renewals last year and 7,000 initial.
Initial, okay. Also, when you had your complaints, I noticed you have the type of complaint. Do you have where those complaints are coming from? Were they coming from hospital settings, nursing homes? Were they physicians? I was curious about that.
We get complaints from a variety of sources. The most common is from the patient themselves or from a family member of the patient. It can also come from hospitals, other physicians, or other licensees. We get complaints from members of the General Assembly sometimes. We a variety of sources. I don't have data on that, but if you want, I can.
It might be something to look at, and is the complaint against a physician or a hospital or a therapist? I mean, that was one of the follow-up questions, I guess. You can tell what kind of complaint it is, who it's from, and then what was it related to?
The profession?
Yeah, the
Yeah,
profession.
we can pull that data.
Okay.
And we can follow up with your office.
Thank you, I would appreciate that.
Yes.
I don't see any, oh, we do, we got one more question.
Okay.
This is just a quick question because I don't know the answer. Does your relicensure, will that be transferring over to the GOLD system, or is it a separate system? I see you utilizing funds to upgrade licensure application software.
Goals? system?
GOALS, okay.
Oh,
You just answered my question.
Oh, okay.
Thank you. Some of the other,
Oh, yeah, yeah, we're, that's the Secretary of State's new system. We're not
Different.
affiliated with
Thank you.
SOS, so, yeah, sorry.
Thank you very much, we appreciate it.
Thank you.
Okay, our next speaker will be the Georgia Drug and Narcotics Agency and their director, let's see. Thank you. Director Tufton, thank you. Shouldn't take.
Good afternoon. Thank you for the opportunity to come and speak with you folks and Madam Chair and members. Update you, well, first I think some of you know this, but as the Georgia Drugs and Narcotics Agency is the enforcement arm of the Board of Pharmacy here in the state of Georgia. We do criminal enforcement and we do regulatory enforcement for that Board of Pharmacy. We have very little changes in the FY 24 budget that's coming up, but I do want to add my thanks to that $1,000 supplement. We have 14 post-certified officers in our agency and 3 staff members, and every one of them were very appreciative of that coming when it did. So we appreciate that. The agency, I will say, last year you approved for a database for us, which we have not had, and the agency's been around since 1908, I believe. We have not had a database formulated for us or set for us where we could track, kind of like the numbers, Madam Chair, you were just asking the medical board of types of complaints. And, well, we have, after y'all's goodness last year to us, we have are in the implementation process of that right now with the vendors, and we're into the weekly meetings. I think it will probably, we also help with the licensing. We help the board with background checks and investigations with licensing as well. So the implementation of that databases, I think it's going to come in 3 parts. It'll be applications and then inspections. We do all the inspections in pharmacies, just so you know, of the 12 agents who are on the street did about 2,500 inspections last year, and that is going into any and every licensed facility, pharmacy licensed facility in the state. So we do a lot of visits in pharmacies every year. But the database will be tremendous for the future. It doesn't have the old information in, and if we can ever get it going, we'll try and get some of the old information in, but we will be able to track things much better, types of complaints, areas of the profession that the complaints come from. But so as far as our FY24, you'll see there the 17.18.1, that's the $1,000 that came to all the employees, the 17.18.2. What that is additional monies. When we got this database, they were numbers from 2 years ago, because you actually approved it twice, and one time it happened to be sort of pulled back from us. But so the numbers that were in that database to get it, the cost of it went up a little bit in the last year. And so that's the $5,250 would be to cover that administrative cost, not the administrative to us, but to the vendor, to get us through the amended year. And then we'll have a small bump we'll be asking for in the next year's budget.
I don't see any questions, so we appreciate your information. Thank you.
Yes, ma'am, thank you.
Okay. Next, we have the Georgia Department of Public Health, Dr. Comey. Dr. Comey, she's great. She's great. She knows it.
Oh, okay. Great. Hello, everyone, and good to see you again, Madam Chair and members of the committee. It's good to be here. It's never good to be the closer of a meeting like this, particularly when there's people following me, but the presentations are in front of me, so I'll be uncharacteristically succinct and to the point. Although I am going to start out with one comment that isn't in your packet, and that's that we are quite an unusual agency, and I've talked about that every time I've spoken to you, and that we have 18 health districts that report to us, run by physicians that report to me, but the county health departments are technically independent, overseen by those district directors, and so that always creates some opportunity for leadership and collaboration, I'll say that. But one of the things I wanted to point out to you that is so really beneficial to us, and we are so grateful to the governor, is that when he put in that $1,000 additional for everyone, it included the 4,300 county employees, so the Board of Health employees, as well as the over 1,000 state employees. And that really helps us, is so that everybody is treated equally, whether they're state employees or county Board of Health employees. And that really allows us to function most optimally and as the team that we need to be to serve the state of Georgia. So I just wanted to acknowledge that with special thanks to the governor. And if you look on the second page, the $1,000 salary supplement across all programs, you'll see that every single program is touched by this because there are programs, throughout the state. 80% of this money goes out to the districts. And I think that's significant, just like more than half of the grant and aid, state dollars that we get goes out in grant and aid to counties. And I'm just saying that because it really demonstrates how we work in a partnership. Getting now to the program budget and the changes. The first one you'll see on the list is for the DPH, Departmental Admin. That's restoring the Clayton District Health Director position. I don't know if you remember a few years ago, we were trying to move Clayton District into the LaGrange District as a cost-cutting measure and to consolidate those two districts. I think at the time it was pre-pandemic. We never anticipated the impact of the pandemic, but also the challenges we had. And I don't mean politically, I just mean that just operationally, very, very different counties, very different viewpoint. And we ended up with a much more of a challenge in making that change than we had anticipated. And so we actually would have had hired a district health director, but didn't have state funding to support that position. And any leadership position like this really needs to be on stable state funding and not kind of cobbled together with what we were able to pull together either through grants or other opportunities. And so I'm really pleased to see the governor recognize that, heard our plea, and put that into the budget and we'll carry that over into the next year so that this will be a stable state-funded position, which is filled, which is not the case for some of your health director positions in other counties. You'll see that there's kind of an unusual transfer of funds from infant and child essential health treatment services into other priority programs. And so rather than focusing on the transfer itself, I want to focus on the programs that were funded, because this is what is kind of I think, mission critical for us at this time. One is the prescription drug monitoring program is, as many of you know, because I recognize that a number of you and Dr. Newton, Representative Newton is also on this program, as I am. We register as part of our licensure, really, to be able to practice and prescribe controlled substances and to monitor patients. And so it was particularly important, I think, during the early stages of the opioid pandemic, because we could see what patients are doctor shopping, what doctors may be overprescribing, and now it allows us to continue that monitoring, even as we're looking at drug use through other non-prescription drugs. And I think what has been really helpful is that, we have had such a good participation, 92,000 providers, 6.5 million drugs prescribed, and 1.9 million patients. So this is really an important program. But it was both federally and state funded, and we just didn't have enough money to continue in this program, which was a state mandated program. And so this allows us to continue that program optimally. This is not staff, this is software to continue that work across the program. And I did want to point out, some of you may have gotten, just like I have gotten, a number of queries about, particularly for those of you who may be in areas adjoining other states, but what about people who go across state line? Can we get their drugs, get their prescription records from this system? And in fact, we actually have coordination across almost all states to share that information so that we can, so that in northern Georgia, they can see when a patient goes to Tennessee and vice versa. And so I think that is part of the kind of the power of this, is that there's so many states, almost all states are participating, and this information can be mission critical for the care of a patient. Looking to the next item that was funded through this transfer was the epidemiologist position with a low THC program. Some of you may have heard about the THC program or had, or part of the discussions that first permitted this program to exist. The role of public health in this program is actually to issue the cards, working with the Composite Medical Board, and ensuring that the licensed physicians only are the ones who participate, and that they're licensed here in Georgia, but don't necessarily be resident in Georgia, but are licensed here, have valid licenses, and then we issue the cards that permit patients to go to a dispensary to get the product. What we found fairly recently, and you may have read it in the paper, I will explain that when the dispensaries opened, there was a huge rush to get these cards, because now this was easier to avail yourself of in Georgia. And so we couldn't keep up with the issuing of cards and got a backlog of data. And I had actually pulled the COVID epidemiologist into this to look at the data and see what was going on within this system, because there hadn't been a kind of systematic data analysis. We got that going, thanks to our crack epi team. They updated the data, and we have really weekly updates of providers, and have worked with Mr. Dorsey Director Dorsey on this whole process, and worked and coordinate with them about data sharing. So it's been a wonderful partnership with the Composite Board. And so I'm really pleased to see how that's going, and we recognize we need somebody there doing it full time. Not someone's going to be pulled off into the next pandemic that I hope all of us will never see, but we need to prepare to ensure the sustainability of this program, which I think will only grow in importance as things go on. And so it's a single epidemiology position that will allow these data to continue. And the last and final things is Gavers. And I am finishing, Gavers is the software package that funeral directors, physicians fill out, because the death certificate is, critically important, obviously, just to initiate the death and burial. And the old software was very cumbersome, hard to enter the data and hard to get the data out. And so it really was an efficiency issue. This is a one-time upgrade just to the software. And it's much appreciated both by physicians and funeral home directors. And that closes my presentation for a record-breaking time.
Thank you for this vital information. It was very good. Are there any questions? I don't see any from our committee. Thank you very much for this presentation.
No,
We
I
appreciate
appreciate
it.
every one of you. Thank you so much.
Thank you. We do have some public comments. If you've signed up, please be prepared. Our first sign up is Representative Park Cannon. She may have had to leave. Okay, next would be Amy Hughes. If you could come forward. If you would please introduce yourself and who you represent. Thank you.
Well, yes, ma'am. Good afternoon, Madam Chair and committee members. My name's Amy Hughes, and I'm with Hughes Public Affairs, and I'm representing my client, Hospice Savannah, who is a legacy nonprofit hospice that served coastal Georgia since 1979, so one of the first hospice programs in the United States, actually. You might remember during the DCH budget presentation last week that establishment of one or more PACE programs was listed as an agency highlight for FY 2025. So PACE, which stands for Program of All-Inclusive Care for the Elderly, it's a very important program for disadvantaged senior citizens who are nursing home eligible, and it's currently offered in 32 states. And specifically, it's for seniors who are over 55 who are eligible for both Medicaid and Medicare. PACE provides the health care and the wraparound services that enables them to age in place in the comfort of their own home with their loved ones and avoid unwanted placement in a skilled nursing facility if that's their desire. Chairman Petrie, I believe, is carrying the enabling legislation for this program in his committee. So you might ask, if PACE is about living, what does Hospice Savannah care about it? Well, the mission of Hospice Savannah is we help people live. And so we've got 45 years of experience in our community with engagement, serving all people regardless of their payer status. So we're planning to respond when DCH puts out the RFQ for interested providers for coastal Georgia. So these are our folks, and we want to ensure that they can live their lives with dignity and with inclusion. And we really, truly get of the strain that caring for the chronically ill can place on families, so we really want to help. But also, you know, Hospice Savannah already provides many of the PACE services, such as functioning in interdisciplinary teams, responding to patients in their homes 24/7 to keep them out of the emergency room, and providing a continuum of care through our Caregiver Institute and our Palliative Care Center. So we'll be able to stand up the required network of 26 dedicated disciplines. And most importantly, we've already got an existing building that we can renovate as the day center to provide the necessary rehab, infusion therapy, and interventional care to the PACE members. So we hope we'll be selected to serve our community, but we don't know, of course. But even with this Head Start that I just mentioned, we think it's going to cost about $7 million to stand up a PACE program in coastal Georgia. And you see a breakdown of that in that document, specifically costs that we anticipate would be for renovation, equipment, transportation, staffing, and training. So we just wanted to take a moment to point out to you that it is indeed a legitimate use of ARPA dollars to fund PACE expansion of community-based services, and it's something we're trying to look into because a number of states have already done that because it's funds that are zero risk of clawback by the feds for those expansion of the community-based services. So today, should there be any undesignated ARPA dollars or state appropriations available, it would be helpful if one-time funds were designated to assist whoever is selected to start out the PACE programs in Georgia so that we can support our senior citizens who are dual eligible to help them stay in their homes, age in place with their families and their loved ones.
Yes, we do. Representative Hughley, you have a question?
Yes, Madam Chair, thank you. I see that this is about the coastal Georgia area. In the rollout of this PACE program, where else in the state do you anticipate
these will be. Well, what I heard the commissioners say in the budget hearings the other day, where they were looking at metro areas that have the necessary patient population numbers of people who are dual eligible. And the first ones that they had identified were Atlanta, of course. I think he said Fulton, DeKalb area. Second, Macon, and also Savannah. But he did mention that he thought Augusta and Columbus were also might have the necessary thresholds for programs. If you look around the country, you know, it depends on the size of the state, but usually there's like 6 different PACE programs, and each program is unique and independent, and they serve that community, so they can really be in touch with the people in that community.
Thank you.
I have a quick question, too.
Yes, ma'am.
Is this all treatment at your sites, at your centers, where the I'll use the term daycare, where they could come in during the day and have something to do and have socialization with other people, so they're not stuck at home?
Absolutely, that's a huge part of it. You know, if they need to get their hair done during the day, it's a one-stop shop, so they can come in and the podiatrist will be there on Tuesday, and the hair lady will be there. They'll have their rehab there, and that's why when you look at like the expenses to start up this facility, a lot of what you have, for example, are medical equipment and all, specialized medical equipment, like for example, a scale where you would be able to wheel a person up in a wheelchair and it would weigh them on the scale, specialized stuff like that. But also like gym equipment. I laughed when I saw parallel bars on the list of things. I'm thinking, you know, gymnast swimming, but no, that's a very important thing to help you keep walking, right? So, so equipment like that. But yes, ma'am, one-stop shop.
Thank you.
And if those services are not there, like a neurologist, it's the PACE program that takes you to your neurologist for they have their nurse that takes you there, stays there with you, and brings you back home.
I'm envisioning something like a nursing home, only you go home at night.
That's right.
Okay.
That's right.
Thank you very much. Again, I see no other questions. Thank you. We have Tom Bauer, if you would come forward to the podium. If you would please just introduce yourself and who you represent.
Yes, ma'am. Good afternoon. I'm Tom Bauer with the Georgia Occupational Therapy Association. I appreciate, Madam Chair and members of the committee, the opportunity to talk to you today. You'll hear later from members of the Tri-Alliance that I've also worked with. This is a different part of it, and I'm also speaking in support of an issue that the Physical Therapy Association of Georgia is supporting. You may recall that I know we talked to you, Madam Chair, last year about occupational therapy assistants and physical therapy assistants who are not reimbursed for their, well, they wouldn't be reimbursed, the practice would be, or the services provided by them are not reimbursed by Medicaid in the Children's Intervention Services or the ABD. Strangely, though, they are reimbursed in the school system. So these are folks who are licensed professionals, and they can do pretty much what a PT or an OT do under supervision. The biggest changes, the biggest difference is the OT or the PT would do the initial evaluation, and then under the supervision process, they work to make sure if the plan is being implemented or if it needs to be modified. I don't need to tell you that there's a workforce shortage in Georgia. We've experienced a lot that we've had private practices who serve Medicaid, and they're waiting times for these practices to take care of kids with chronic disabilities because we don't have enough providers, especially in rural areas. And this is particularly a problem for kids with disabilities because the more you delay treatment or the paperwork gets hung up or whatever, these kids regress, and then they end up more dependent upon the state for services. So we would really like to see this addressed. The faculty at the programs also tell us that that pediatrics is a big part of OTA and PTA training, and that and these are folks who are going in part of the technical school system, the associate degrees, and they tend to stay in the areas sometimes where they're from or where they're trained, but a lot of them are interested in pediatrics, and they're not staying here because of the Medicaid program is not reimbursing them. You were, along with the Senate, responsive last year to our concerns, and not only put in a language amendment directing the Department of Community Health to develop a state plan amendment for coverage of these services, and also gave us a little bit of money, about $4.2 million, I believe, which we were very appreciative of. Unfortunately, these were items that were disregarded by the governor, so we're back again pleading the same case because the shortage is still here. We would appreciate any help we can have in the amended budget. I'm not sure if that's as feasible, but perhaps the language amendment for sure to get this going. I would also add that we have also talked to the Babies Can't Wait program, and of course they have some Medicaid folks there, but they are also considering, and we've given them information to have use services for OTAs and PTAs. So it would be nice to have consistency as we go along. That's it in a nutshell. Appreciate any help you could give us on this.
Thank you. Does anyone have a question? I don't see any. Thank you very much for your presentation.
Thank you.
Next, we have Kelly Ball. If you would come to the podium, please. If you would please introduce yourself and indicate who you represent. Thank you.
Okay, great. Thank you, Madam Chair, members of the committee. We appreciate you allowing us to speak today. My name is Kelly Ball, and I'm a member of the Georgia Speech Language Hearing Association. And this is Eileen DeoGracias, and she's a member of the Georgia Occupational Therapy Association. And we are here today representing speech language pathologists, audiologists, physical therapists, and occupational therapists working in Georgia Medicaid's Children Intervention Services program, as well as in the Babies Can't Wait program. So we're here today to talk with you both about a workforce issue and an access to care issue. There are numerous children in the state of Georgia requiring the services that we offer, and they are not receiving them in these programs. There's a real shortage of therapists. One of the main reasons for this is the rate of payment that we're receiving through Georgia Medicaid and the Babies Can't Wait programs. Speech language pathologists have not had a raise since 2006. Think about how it would affect your family if you had not had a raise in over 20 years. A lot of providers are leaving the workforce in these programs to go work at hospitals and nursing homes where they're paid Medicare rates, which are about 20% higher than Medicaid rates, or they're leaving to go work in the schools where they get increased salaries every year. They get these wonderful stipends we keep hearing all about because they're working in the educational program. So we're here today to ask for funding, that you raise the Medicaid funding to raise the Medicaid rate to the Medicare 2022 Atlanta Medicare rates. We are also asking for funding for reimbursement for travel. Many of these children are served in the community in pre-K centers and daycare centers and homes. In fact, the Babies Can't Wait program requires that they be seen in the homes, yet there's no reimbursement for the time or expense of the travel. Currently, in Medicaid's Autism Spectrum Disorders program, there is a home visit rate for applied behavioral analysis providers, and we would support the use of this model for our therapists as well in the CIS and Babies Can't Wait programs. So you may remember us from last year. We came last year and you guys were gracious enough to put funding in your budget for this rate increase. Unfortunately, it was disregarded by the governor. So as Tom said, we're back. We are asking for money to be put in the amended budget to cover this rate increase for the last quarter of the 2024 fiscal year, You'll see in green on the second page is the amount that we need, $3,807. $3,807,000, excuse me. We would also like to ask for funding moving forward, of course, in the next budget when it gets to that stage. I'd be happy to answer any questions you guys have, and we appreciate your time.
I don't see any questions, if anyone has any, but thank you very much for your presentation. We appreciate it.
Thank you.
Our next speaker will be Gabriel Carter.
Thank you, Madam Chair, for the opportunity to speak here today. If it pleases the chair and the committee, I also have Josh from the EMS Association. We're partnering on a appropriations request, so thank you all for the opportunity to speak. So again, my name is Gabriel Carter. I am with ACCG. We represent all of Georgia's 159 counties. I'm here today to revisit an appropriations request that was made before this committee last year. Last year, this committee appropriated funds for a 5% increase to the EMS Medicaid reimbursement rate. This budget item was a part of the governor's disregard statement, and unfortunately, this is something we were looking forward to, but wanted to bring it back up to this committee, just hopefully that you all reconsider this and reappropriate funds for the purpose that you all intended when you appropriated these funds in the first place. So we believe that EMS is a vital part of our healthcare system, and these funds will actually help strengthen our EMS system and help us provide some more workforce and address some of the challenges that we're facing with service delivery. So I'll stop right here and stay around for questions, but I'll let Josh from the EMS Association speak on it.
Yeah, no, I appreciate it, Gabriel. I just want to thank this committee. Y'all have really stepped up to help EMS over a number of years, but over the last couple of years. We appreciate your support on the appropriation last year. Unfortunately, as he mentioned, it was disregarded. We know we weren't singled out for that. There are a number of things included in that, but the EMS community is still very much in need of a rate increase, just like other providers, and so we appreciate any consideration you can give. I think it was roughly about $3.2 million in total funds across all three parts of the Medicaid program to do a 5% rate increase. So thank you all for your time.
Thank you. I don't see any questions, so we do thank you for your information and appreciate your coming and sharing with us. Thank you. Are there any others that did not sign up that would like to address the committee? Does the committee, anyone have any questions? If not, we are adjourned. Thank you.